Hello, this is Dr. Marty Klein with more Sexual Intelligence. Today I'd like to take you behind the scenes a little bit and talk about ethical dilemmas in sex therapy. Now, sex therapists can be certified by a handful of private organizations, but they are not licensed by the government. And unlike dentists, acupuncturists, or cosmetologists, anyone can call themselves a sex therapist, except in Florida, where they certify people to use that title. This means that ethical standards in sex therapy are flexible. In addition to believe that what you're doing is helpful, it mostly boils down to don't have sex with the customers. Now, this is good advice, but it hardly covers the various ethical dilemmas in which sex therapists sooner or later find ourselves. And unfortunately, the ethics part of sex therapy training is really brief. So here are some of the many ethical dilemmas that sex therapists, credentialed or not, legitimate or not, face, which almost no one talks about. For example, when therapy with one partner can threaten their entire relationship. Some couples can only survive if one or both partners grow, and in that case, a great therapist can be invaluable. In some couples, one person needs to change more than the other. Sometimes that person wants to, sometimes they don't. Some relationships are unhealthy but stable. For example, when a conflict-avoidant person marries a controlling, aggressive person, this pair of unhappy people can go on forever. The controlling person generally doesn't come into therapy, but the passive one sometimes does, with unreliable erections, low desire, or inhibited orgasm. When this passive person comes in for a supposedly sexual problem, we talk about their anxiety, powerless, and emotional isolation. That inevitably leads to discussing their relationship, integrity, self-esteem, and resentment. The passive person may then realize what they've given up, decide that's no longer acceptable, and start asserting themselves, which often destabilizes the relationship. I can usually see this coming a mile away. So, should I warn the new customer in the first or second session? Should I tell them to warn their partner? Should I discourage or even refuse treatment, knowing the pain they'll be going through, possibly losing their marriage in the bargain? Well, here's another situation. When religion or other cultural value takes certain interventions off the table. Like all experienced clinicians, sex therapists have a set of tools that we typically use to address a given issue. Some of these interventions are frowned on, misunderstood, or even banned by some patients' religious, cultural, or family values. These interventions can include masturbation, sex toys, medication, talking honestly about one's experience, teaching a partner about one's body, refusing painful sex, refusing unwanted conception. When a patient tells me I can't use my best tools, what should I do? Send the patient to another therapist who will tell them the same unacceptable thing? Send them to a therapist who's willing to work under restrictions, which I'm pretty sure won't be effective? Continue seeing the patient or couple, working with one hand tied behind my back, getting inadequate results? Now, here's another dilemma. When another involved therapist is sex negative, gender stereotyping, or damaging. Now, whether I like it or not, there's often another therapist involved in my cases. Either I'm seeing the couple and there's one or two individual therapists, or I'm seeing an individual who's already in couples counseling. Since most therapists get no training in sexuality, and some therapists are, like people in general, uncomfortable with sex, this other therapist is sometimes more of an obstacle than a help. For example, they'll use stereotypes like men cheat way more often than women, not true, or they'll be judgmental. Why would a mature man look at porn? Come on. Or be simply wrong. Anyone into BDSM is obviously emotionally damaged. That is so not true. So what do I do then? I can't simply say, your other therapist is wrong. Saying you should stop seeing your other therapist, it may be smart advice, but almost no one will take it. And that is not a reputation that I want to get anyway. I call the other therapists in my cases way more than most of my colleagues do. Sometimes I'm able to share a different perspective or set of facts. Sometimes The call just confirms my worst fears about an immovable obstacle. Another dilemma: when patients want me to recommend a sex worker, erotic website, or pornography. Every week I recommend attorneys, physicians, physical therapists, and psychologists to my patients. I'm proud of my professional network. But when people ask, how do I find a prostitute, or they want to know where the safe massage parlors are, I simply say, because those things are illegal, I can't recommend anything like that. Too many sex therapists, apparently, are only too happy to recommend this or that marginal option, in my opinion, without considering possible consequences. For example, if a guy goes to a strip club that I've recommended and his wife finds out and gets angry, she won't be eager for him to continue seeing me. Adult porn, of course, is legal, but I don't recommend any specific porn because patients will inevitably read something into whatever I recommend. They'll think it's a clue about what I'm into, or what I think they're into, or should be into. With some patients, it is crucial to talk about porn, and I'm comfortable doing it. While valuable, it's complicated enough without that extra layer of stuff. Then there are couples who want help conceiving, but it's for problematic reasons. At least once a month, a couple comes in wanting to fix a sexual problem because they want to conceive. Is the reason they want to conceive any of my business? Well, what if they don't really want a baby, but they're being pressured by their parents? Or it's culturally normative back in India or China, where they'll never live again. Or their younger sibling can't marry until my couple has their first child. Do I go ahead and help these various couples conceive by enhancing their sexual function, or do I hesitate? What if I genuinely believe that some marriage is so precarious that another kid will destroy it? What if a couple believes the thing that will fix our miserable marriage is a baby, which almost never works? Life-altering decisions like these demand that I think about where my integrity lies and what my call to service is, which I end up thinking about pretty much every week. In sum, sex therapists are trained mostly about sex organs, sometimes about sexual relationships, but most are not trained enough in how to address the real-world circumstances surrounding the two. An ethics training other than 1, don't sleep with the customers, 2, remember not everyone is heterosexual, and 3, get everyone's pronouns right. Well, ethics training is unfortunately slim to none. The real world and the customers it sends us is complicated and nuanced. If we manage to get through a month of practice and to genuinely do no harm, it's a good month. Thanks for joining me. You know, I drop one of these videos every 3 or 4 weeks. If you want to get pinged when I do, click subscribe, and while you're at it, click like too. I'm Dr. Marty Klein. Thanks for joining me.